has asked Acting Director of Health Services to deal on his behalf, to read the statement on his behalf. So we'll give you an update as to where we are and what we have done so far, and then what we also plan to do. So I will now allow Dr. Bitte, the Acting Director of Health Services, to come and give the press statement on behalf of the Honorable Minister. Dr. Bitte, welcome.
Good afternoon once again. We stand before you, like already mentioned, to give the updates on the coronavirus or COVID-19 status in the country. As of now, we have a total number of 16 new samples which were tested yesterday at the laboratories, and they all came out negative, thankfully. And these results included that of the repeat test on a sample from the fourth case. So the fourth case is already being tested, and the first test for the fourth case has come out negative. So if we have another negative test on that fourth case, he would be going home. This negative test also included, like we said yesterday in the briefing, the probable case second testing was done also yesterday, and it came out negative. So it is now conclusive that we don't have any probable case anymore. So what remains is still the 4 confirmed laboratory confirmed cases. A total of 116 individuals completed their mandatory 14-day long quarantine and were thus discharged, leaving behind a total of 162 people who are yet to complete theirs. These 162 will also include the probable case, because it has to complete Monday, even though it was negative. Initially it was probable, so it was tested again, it was negative, so he has to complete the mandatory 14 days. 5 foreign nationals who recently sneaked into the country were apprehended and are placed in mandatory quarantine. Cumulatively, the country reported a total of 4 laboratory confirmed COVID-19 cases, 2 of whom have recovered and 1 passed away. It is important to note that all 4 confirmed cases are imported. There is yet to be any evidence of the existence of local transmission up till now. As a country, a total of 129 laboratory tests have been conducted to date. We have seen a significant reduction in the volume of calls to the 1025 hotline compared to the previous day. So we are asking, could this be attributable to complacency resulting from the brief lull in the country's report of new confirmed cases? Is it because we've not been having any new confirmed cases, so nobody is calling, the calls have dropped? So we are just advising that let us please keep the momentum and not relent, because the pandemic is still showing no signs of abating. So we should still take it as a very serious disease and continue to ask our questions and continue to do what we used to do to prevent this disease. Just because we are not reporting new cases doesn't mean that we should rest on our laurels. The public is therefore urged to continue playing its part by reporting any suspected cases through our toll-free lines on 1025, following the preventive measures. Finally, the Ministry of Health appeals to the general public to remain calm and vigilant, and every Gambian and resident of the Gambia has a role to play, and together we will combat and successfully contain the outbreak. So thank you very much.
Thank you very much, Dr. Bitte, for that encouraging statement. And as Doctor said, there's no room for complacency. We should remain vigilant. And if you look at the situation report, we always look at regional situation and global situation, which means as long as the COVID-19 epidemic is widespread, even if Gambia continues to have 0 cases, we are still not done, because our neighbors, as long as Senegal has continues to report cases. We have to remain vigilant, and we thank all our people who are working to ensure that our borders remain under strict control and supervision. That's our challenge, and we have to continue to be reporting. We have to continue to follow the precautions, the precautionary measures that are officially recommended. I would like to invite the media for 2 or 3 questions for Dr. Bite to answer. We allow the director to say something. The floor is open for any questions. Remand.
So, Ibrahim from the iAfrica TV. So today there was a sort of ceremony to witness the dischargement of the first batch of those who completed the quarantine. And part of our reporting procedure, some people raised queries as to the need for privacy. Where do we strike the balance as to those who are confirmed and those who are just on ordinary quarantine? Do you have any difference between the treatment of the two?
The director was there this morning. He can explain.
Thank you. That was a very good question. The people who have been discharged today, there are 63 in number, and 59 from Marcus, and then 2 from our facilities, and then other 2 from they are also within the community. Basically, those people, none of them have the virus, according to what has been tested. Only 10 have been suspected, and they've also been tested, and they're all negative. So the rest were just being quarantined, which is also a public health requirement, that if you have to put anybody on quarantine, they must have to stay for the period of 2 weeks. And that was what happened, so that is why they were on quarantine. But actually, they were not sick. Nothing has happened to them, especially those from Maracas. Nobody was sick. So they've just been discharged from quarantine. Doesn't mean that they've been discharged from hospital. They have been discharged from quarantine. Meaning the quarantine period they are supposed to serve has already elapsed, so they have to go back to that. And they are healthy. They have not shown any signs. So to us, they have also completed the 14 days period. So we have allowed them to go back to their families. We also advise the public to be mindful not to discriminate them, and also not to stigmatize them, because they have gone back to communities. So they have to embrace them, receive them open arms, and then give them love and support, so that they can also be able to feel that they are part of the society. So that's also very important. We really emphasize on that. But actually, for us, what we have seen in them, they themselves really were very happy with the services that the ministry provided. And then, although the Amir, really didn't want to come out and talk on the television, but what he told us was definitely, in fact, among the visitors from India and Bangladeshi, they didn't want to go. They wanted to stay extra 1 month. And because the care they've got from our facility staff and the support, the psychosocial support, the friendliness of our team, so they feel that they've been taken care of. Government really considered their welfare, and that was really given to them. And also the health service that also required for other people who have other underlying causes. And then perhaps they have, there are other diseases like, for example, it could be hypertension, diabetes, and so on. So at least those people were also managed by, you can see the doctor was there who was also looking after them on a daily basis. So really that was something that we feel that it should happen. And then they really requested for that to happen, for the ministry to definitely show people that they have been quarantined for 14 days. And interestingly, they themselves were definitely requested for, in fact, they voluntarily went to the quarantine center. So meaning that they really complied to the rules and they complied to the regulation. So therefore, they completed their quarantine period without any problem. So I think that was something that we expected from them, and they are happy with it. Thank you.
Thank you, Dario. We have one more question.
The minister always emphasized the fact that the ministry is working to strengthen all the health facilities in the country. I just wanted to have a clue as to the preparedness of our health facilities, especially in the provinces, looking about Somal, Bansang, Parafenya, and the other places. How prepared are these facilities, especially after 1 month of this outbreak in the Gambia?
Doctor, would you like to come in?
Yeah, so thank you very much. First, I'll just talk about privacy is very important to the ministry. And like the director said, we take it. But in this situation, we are gaining a lot of things from it. Also, you are fighting against stigmatization. And this was a big problem in these situations. So that's why it was very important to have that. So for the preparedness, this is a process and it's always ongoing. And so a lot of trainings have been done. The structure is well explained. You can see that right now we are in touch with the people in Basse. Right now they are telling us about what is going on, who has to come, and we are coordinating. And patients have been moved from Basse so it's a structure which is more important. The people on the ground, are they trained? Do they have the required materials when it comes? Do they have the required knowledge? Do they know how to contain it? Do they have the isolation rooms? And if there is a need, can they get the lab test done? As at now, people have been trained in the regions who should be able to take the labs. And what has happened, for example, in Basse in the last sample collection that was done, was people from the central committee just went to supervise. After they've gotten the training, it is not, you have to have a case to practice it. And they don't, just after the training, they won't allow you to do it. So the first one or two, you have to do under supervision. And that's why the team had to go there to supervise that. And so this is ongoing, and its progress is going to get better. And as more equipment come, more things come, then, and as it evolves, a lot of things would be also put in place. So yes, it's a process, and we are still going on.
Thank you, Doctor. Yeah? You have one question?
Okay. I'm Lamin from Africa. I'm sure the ministry have seen some few documents and messages which emerge on social media in relation to some appreciation or some information on official letterhead of the government. No need for me to go further. What's the reaction of the ministry in such?
Thank you. And Director will discuss it, and he wanted to say something about that today.
Yeah, with regards to what has been going around in the social media, that is the opinion of the people who are sending the information to the social media. But what actually really happened is that the Honorable Minister's name appeared on the list that he didn't authorize. And then, as you know, there is a list of lists that are prepared by the ministry, a list to support and give a token to the frontline health workers who definitely have been, for example, exposed. They could also be exposed to risk or so on. That's the whole idea of just supporting them because they have been working from January to now, and then the ministry feel that there's a need for us to give them that support. And then as a result of that, the minister made it very categorically clear that his name should never be listed, be among the list. This was done personally in my presence, and I think even those who were mistakenly, put his name there, perhaps they even said that it was an error on their side. They should have vetted it because actually the minister said it, repeatedly, about twice in my presence, that whatever we are doing, whatever preparations we are doing, whatever list we are preparing, his name should never and ever be on that particular list. This has been his emphasis. And then we know that the Director of Planning, we are the ones who are working on the list together with the deputy, and then they also oversight that his name was there, and then they also passed it to the permanent secretary, and mistakenly the PS also passed it to the committee member. This is what has happened. This as well known. And then the letter, what people saw on that on the social media, it is the letter that PS wrote to himself and to the Director of Planning and the Deputy Director, now giving them a warning. And then, unfortunately, somebody within us just took that letter. It's an official document, and then somebody just took that. You can see how indisciplined people can be, how people, just be there to disrespect authority. If an official letter is written, there is no need for someone just to pick that letter and start to expose what is happening. But there's nothing bad in that. What the PS did was just to warn himself and to warn the deputy director and the deputy director for the actions they have done, including the Observer Minister. Just a warning. And people are saying they've been suspended, people are saying they've been threatened. None of those things happen at all. None of those things happen at all. What that letter specifies is that it's just a way that just to ensure that it doesn't happen again. But the minister definitely felt very bad about it. He wasn't happy because his name has been mentioned, and he's made it very clear at the beginning that I don't want my name to appear on a list, that because I am doing the work for the service. I mean, I'm doing the service for the Gambian people. I am paid for that, and I'm doing this work on gratis, and I don't need any pay out of it. That was the state message, and that message was very clear since day one. So, and I think this has happened by mistake that it has escaped the director. The deputy director also escaped the permanent secretary, who also passed it to the committee members, and then the letter the letter that was written by the people, by the PS, is just a warning to himself and the director and also the deputy director. That was what has happened. But there is nothing. And also, people are talking a lot about the 400,000. Today, 500 million. Today, I received a lot of information on the social media, on some other radio stations are ready. They're saying they're going to expose the Minister of Health. They want to come up with a scandal. We are ready. We are very much ready with any information anybody can pass. That is your opinion. In fact, somebody called me today, and the same thing I told the person is that we are all working for the Gambian government and for the Gambian people. We know that it's a bad practice to steal government money. We all know that, and we all work according to financial instructions and also the GPPA regulations. We all know that there's a committee that has been set up to manage and to ensure that funds are utilized the way it should be. That's comprised of the Accountant General's Office, the Permanent Secretary, Minister of Finance, the Director General of GPPA, the Director of Internal Audit, and our Permanent Secretary and our also Internal Audit. So you can see how the Minister, because the Minister doesn't even sit in that committee. We want to make it very clear. The Minister does not sit in that committee. It is only the technical people who sit in that committee, and then they look at documents, they look at invoices, they look at proposals, they look at submissions, and they also look at certain documents that come from implementing partners. And also I want to make it very clear that also if a proposal is different from, approved, like for example, the list that has gone is a proposal, and it's also left to the approving authority to approve and do the payments. So people also have to do that, have to make that distinction. It has to be very clear that what you propose does not necessarily mean that is what is going to be approved and give the money. So we have to understand that we are in difficult times. People have the time to sit and criticize the Minister of Health. People have the time and to follow whatever the Ministry of Health staff are doing. And I think they have that time. We want to thank them for the time. But let them also report on something that is real. That is something that everybody should know, that when you die, tomorrow you'll be accountable to whatever actions you have done. You'll be in the grave alone. So there are a lot of accusations we are going through. We want to advise the public. Whatever you are saying, think of the next world. Think of your grave. And think of the people you are making accusations and false names on. We know what we are doing. Even this money they are talking about, I can tell you, the monies have not even reached to the Minister of Health. We will tell you very clear. We are just working on certain documentation, certain principles, and so that will guide. And there's also ministry, as Dr. Bide said yesterday, there's an account that has been opened, and that account is going to be monitored. Let me tell you the government procedure. If any money that goes to the central government coffers, it will be difficult for someone to have access to that money. Why I'm saying this? It will come from the request might come from the Minister of Health. It goes to internal audit for vetting. From there it goes to Accountant General. From there it goes to Treasury. From there you take the check to Central Bank. All those processes go through vetting processes. It will be difficult for someone to sit, it will be easy for someone to sit in your office and accuse the Minister of Health to say that they will be eating this money, coronavirus here and there, just come there, corona and corruption. We are sharing a lot. We are monitoring social media, but we are also, because we will not respond to every social media claim. We don't have the time, but we can also give you the factual information. And even anybody who doubts whatever we are doing, kindly come to the Minister of Health, kindly walk into the office of the Permanent Secretary, kindly walk into the Accounts Office or the Internal Audit Office. You will get everything that is clear before you sit down in your little corner and start making speculations about the Minister of Health. We will always give you an update. There will be a time we'll also be reporting on financial report, because we've not started actual spending of the money. When that happens, we are going to give you technical reports, and we're also going to give you financial reports, so that you know where we are. We are very transparent with what we are doing. We have a leader that is really focused, and he knows what he's doing, and he's also scared of trying to do things that are not right. So that's why he said, I don't want things to happen. I don't want, in fact, you can see the GPPA Director General. They're just in that meeting. You can see what God can do. They're already in that meeting, and they're just from that meeting. They're already currently in that meeting discussing about what we need to do. So you can see, we are very open, and we can always, people can always come to us and look for information. We will give you. We have nothing to hide. No, we are very transparent in our setup, so we are happy to give you any information that you require. But what is bad is just to sit and speculate about the Minister of Health and the government of the Gambia. Thank you very much.
Thank you very much, Director, for that elaborate question. As you said, transparency is the key, and I remember we even started talking about it, like, quarantine is expensive, it's an expensive business. It's like, taking a whole hotel, putting people there for the stipulated 14 days period. I think the last time when we checked, it cost the Gambia government 1,500 per night per person. Do the maths and you will know it. And then in URR, I think, it costs us $23,000 per night for the people that are placed on quarantine. So all the money that is talking about is going back to the public. They are the first beneficiary. Of course, we want people to go back to their normal lives, but in this situation, the people who are under quarantine, who are under treatment, their welfare gulps a lot of funds. So anyway, as you said, details will be made available to the public. Those who want the facts will always get them. Any more questions? Or Dr. Bide, would you like to say something? Okay.
Yeah, just to thank you once again for coming and look forward to seeing all of you again. The stigmatization, you should emphasize it so that people are not stigmatized as much as possible. And I think that was very important activity in the morning to ensure that people are not stigmatized. Thank you very much.
Thank you. As the doctor says, stigma is very important. Anybody can be the next. We can be making fun against somebody that the person has corona or the person went through quarantine. Who knows? This is a global epidemic. It can catch anyone else. So that's why stigmatization and prejudice is something that we should all try to fight against. On that note, I thank you all, and then see you tomorrow.